So hello and welcome you all to Sail to MDS Dental Academy. Myself Dr. Malay Trivedi, I am pediatric dentist and assistant professor in College of Dental Sciences. So dear friend, as we have promised, we are going with the orientation lecture part 2. In part 1 we have discussed about the options available after BDS. Then we have discussed that what are the key ingredients you require to be the good dental surgeon. Then at the end we have discussed whether your dentistry is saturated or not by comparing the past, present and future of dentistry. In this we have compared the 5 to 7 years of dentistry. So now we are with the part 2. In this part 2 I am going to explain the options available after BDS in detail. I will explain you the pros and cons so you can take your decision what you have to opt. Fine. So first we'll talk about the abroad dentistry. So dear aspirants, now I am going to tell you as a decision, because I want that whatever decision you are taking, you should follow completely. There should not be dilemma in your mind, like some of your seniors saying, okay, go for MDS, you are going. Some of them are telling, go for abroad, you are doing. No, you should properly compare your present and future and then you should go. So that's why we'll tell it as decision now. So first, the decision one is your abroad dentistry. So this is booming. Many of are opting. I have seen many of my students when they are in the final year or the coming to the internship, sir, we want to go to abroad. The India में dentistry में कुछ नहीं रखा. This is the common line I always hear in the beginning of the dentistry. So let's talk the few pros and cons of the abroad dentistry. So commonest country followed for the abroad dentistry is the Australia, Canada, US and New Zealand. Most of people are going for this. So dear friend, for going to abroad, a few basic requirements are needed. You should not just tell, yeah, I'm going to abroad. You should have in your mind a few basic requirements. Like to go to abroad, first you have to clear the language exam, like your IELTS and TOEFL. Then you have to clear the equivalency exam. What is this equivalency exam means? It's a multiple steps theory and practical exams. Mind well, this theory exams comes in the MCQ format. Around, for example, you compare your Australian Dental Council, they have 2 theory and 2 practical exams. So this MCQ are of very high quality. You can check out the papers. You have to be very, very proficient. You have to work hard properly if you want to create this equivalency exam. It means you are becoming equivalent to the dentist to graduate from the concerned country dental schools. So in this way the exams will be there, and practical exam they consider as a bench test in which you have to follow the proper protocol of doing the patient on the phantoms, starting from the, for example, if you take the conservative dentistry, starting from the rubber application, all the cavity preparation and all that. So there comes the equivalency exam. Then after, if you clear the equivalency exam, then comes the license exams to practice in the concerned state or the country. So in this way, to go to abroad you require 3 things: language exam, equivalency exam and the license exam. Then I have given one small example for the Canada. Canada, you know, there is a NDEB program for the non-accredited and the accredited dentist. Accredited means the country's dental courses they have considered to be as eligible. Our Indians come in the non-accredited. So I just explain few steps. For example, if you want to go to Canada, you have the NDEB Canada equivalence process. Then there is a test of fundamental knowledge. Then we have the test of clinical skill. Then there is a written exam and OSCE, and there is a Canada certification exam. So in this way the steps are there if you want to go there and practice as a dentist. And I always request my dear students, please don't just go like that, and don't, I've seen many of the students who are going there and end up doing in other thing rather than dentistry. So please, you have given your precious 5 years of becoming the graduates. You are planning to go to there and practice dentistry by working hard, then only you should go. But don't end up doing in some other things. Fine. So we can come to a small conclusion that it requires time as well as money for them. For example, if you take the Australian, for the Australia if you want to go, you require money of around 10 to 15 lakhs. The basic course or the basic course of that, the basic exam fee is only 10 to 15 lakhs. And the exam comes in 4 to 5 intervals, and you have proper time also, because you have to clear each and every step. If you fail in either of this step, once again you have to repeat. So you require ample time, around 4 to 5 years, along with the ample money in lakhs. For example, for ADC it's around 10 to 15 lakhs, and for the Canada it is around 20 to 25 lakhs. It is variation depending on the condition prevailing. So now decision 2 is the clinic opening after BDS. So dear friends, clinic opening is always the good option after you do the BDS or the MDS. But before opening the clinic, ask yourself this 4 thing. That is, I made one acronym, that is a EPIC. Fine. So E stand for the exposure. Remember, before you open the clinic, you should know that whether you have enough exposure or not. Just by doing the 5-7 root canal, you cannot attempt or you go for the treatment of patient, because once the failure in the clinic, it will be the permanent, and the initial day failure should not be not there. So you should have the enough exposure. Second, the proper patient management skills. Along with the dentistry, you should know how to manage the patient and the other aspects related to dentistry. Third comes the independent confidence. Means you should have proper confidence in doing 3 things. There is a diagnosis of the treatment and the prognosis. Always your dentistry is related to these 3 things only. That's a diagnosis, treatment and prognosis, which will increase your confidence and decision making whenever you are doing any of the case. Then 4 comes the competency of the basic clinical work. You should be able to do the basic procedures which normally carry out in the day-to-day of the dentistry. Of course, consultants will be there, but you should be competent enough to do the basic clinical work. So friend, there are few mistakes made by the students during internship and after BDS, and I don't want them to make this mistake. So the 4 mistakes which I have jotted down. The first is joining some clinic or trust. I have seen many of the dentists in the internship or immediately after internship, they are joining some clinic or the trust. You are giving your precious 1 to 2 years. Why? Instead of that, you can join the MDS. And yeah, I can believe you may have some monetary problem, but mind well, dear student, I am not telling you to go to MDS in the private colleges. Go in the government college. First day only you will have a stipend of 40 to 50,000. So please don't waste your time in joining some clinic or trust. Okay? Why? Because when you are learning something, you should learn step by step. And in clinic, it is not possible to learn the things step by step. There are chances that you may learn the clinical skill by skipping few steps, and that will affect your future dentistry. One more thing I have seen students are making mistake is doing some short clinical course. I have explained in the another video the importance and drawback of this short clinical course. Then the biggest mistake you people are making is comparing yourself with the experienced BDS or senior dentist in your locality. Many times students are tell, सर वो मेरे community में या मेरे society में एक BDS है, सर उसको बहुत patient आते हैं. Then why MDS क्यों करना है सर? Dear aspirants, remember they are experienced BDS. They are there in the town from 10 to 15 years. During that time, the BDS was only a big thing. So they have already settled. You have to come in the market. You are new in the market. So don't compare yourself with them. Please try to avoid this mistake before you take the decision to open your clinic or not immediately after BDS. And few other important points, that's a current scenario of colleges. So I have seen many of the private colleges, the student passing BDS from there have very few clinical skills because very less patient exposure, as every college now MDS and most of the patients are being treated by the MDS only. So please take care of this market, know the market values. If you are in good big city, that is tough to survive as a new fresher BDS. And one more thing is dental technology. As I have told, you should always update yourself with the new technology coming in the market, because this new technology help you to earn more as well as to be updated in the market. So with this we are ending this second video. More two diseases are left, which I am going to deal in the third video. So please kept in mind, I have explained these two options, that is the abroad dentistry and the clinic opening immediately after your BDS.